this episode of Horse Shelter Heroes.
So over the weekend, Jolene did foal. It appears as soon as that baby hit the ground, Dottie stole it.
This week is our buyout week and we are very, very busy. We have horses coming in basically all week.
Before they unloaded the trailer, they did tell us that they had a horse in there with in-place trach. The smell is absolutely nauseating. It's completely infected.
Well, the Department of Egg guy apparently is still trying to keep us out of Cookeville.
Oh man. He's like a yearling. He's got all baby teeth, it looks like to me.
These two law enforcement officers and the representative Tennessee Department of Agriculture show up at our front door. The second they heard we had an attorney, one of them, his entire demeanor changed.
You don't want to miss a single second of Shelter Heroes.
So over the weekend, Jolene did foal. We were wondering if she was going to be due soon, even though her test showed that she was not pregnant, didn't have the progesterone levels. And it looks like Dottie stole Jolene's baby.
Little baby, that's not your mom.
So we have to get Dottie out of here, but Dottie is also difficult to catch. So we'll see if we can get her caught.
Yeah, that is way more.
Dottie's being very protective like it is her baby.
Come on, Jolene!
So we're trying to get Jolene and the baby together so that way they can bond a little bit. It appears as soon as that baby hit the ground, Dottie stole it. So we're not really sure if it's had a chance to eat yet or poop or anything like that. So we want to make sure it has a chance to do that so it can actually have a good chance of survival. We're also going to monitor it and see if it poops and does all that. It is moving very well. We should probably check its umbilical cord too since we got it up and make sure it's sanitized, because if it gets infected they only have a couple weeks to live.
So we got Jolene in the January buyout. At the time we suspected that she might be pregnant, and actually her pregnancy check where the vets palpated was negative, but apparently the foal was just too low to be able to feel because she was definitely pregnant, but the vets are gonna tell you more about it.
We had a fun surprise this morning. Jolene foaled last night. So I pregnancy checked her via palpation and didn't feel a baby. And then we ran progesterone on her, which we picked the wrong hormone in hindsight. Her progesterone was super low, but because she was so thin, we thought she was at like mid-stage pregnancy and she was really at end-stage pregnancy. So she had a little filly. She looks very healthy, but our plan this morning is to administer an enema. She has passed some meconium, the first baby poop, but she's been seen straining a little bit. So Dr. Gina's getting enema supply set up. We're gonna pull some blood and run a CBC chemistry and also measure her IgG. That is the immunoglobulin that will tell us whether or not she got colostrum. So unfortunately, we think she was born overnight and Dottie stole her from Jolene. So when we got her this morning, Foal was right with Dottie and not with Jolene, but as soon as we separated them, Jolene started being a great mama. So we're hopeful that the foal had a chance to nurse before that separation happened, but we're still well within the window where that baby can absorb those immunoglobulins from mom. But we're gonna do a snap test just to be on the safe side. We're gonna try to be really calm and quiet, kind of keep things to a minimum. Hopefully we won't have to sedate Jolene. We wanna keep things as stress-free as possible, and then we're moving them to a separate paddock where they have a lot more grass and it will be a little bit quieter and more separated from Gen Pop. We were able to do a quick exam on this new baby. We pulled some blood for CBC Chem IgG. We gave her an enema and everything looks good. Her capillary refill time is normal. Her gums are nice and pink. We gave mom a little bit of some anti-inflammatory medication and some probiotics, and we're gonna put them back together now.
This week is our buyout week and we are very, very busy. We have horses coming in basically all week. And so the first group is here. There's more coming in today. And so far this group, I mean, everyone is able to walk and we see some neurological concerns. One is completely blind. And we can tell that these horses, at least some of them have been through auctions before. And the blind horse face is truly what blind horses look like when they've been in the slaughter pipeline, because they've bashed their heads into so many things, from being taken from one strange place to another, and his face is really heartbreaking.
When she was looking, I don't know if you can catch it on video, but the sclera is very yellow, and usually that's an indicator of liver disease or liver failure. So we're gonna try running some blood work on her.
Hi, sweet girl.
Sorry.
No, you're fine. This is great. You know what? That probably needs to be sutured.
Yeah.
I know, big girl. I'm sorry.
I wouldn't doubt it.
So she's got a full skin thickness puncture over this eyelid that will probably suture up. I'm a little concerned about her systemic health, so we're going to run some blood work. Dr. Gina gave her some pain meds. And if she is stable enough to undergo a little bit of sedation, we'll fix this eyelid. I know, honey, I'm sorry. So he would need bilateral enucleations.
He's got a good personality.
He has a great personality. Okay, I don't have an age on him, but he needs some pain meds. This sweet boy has two really painful eyes. You can see he has blepharospasm, which is he's really squinting and his eyes are watery. And it's happening with both of his eyes, so he needs bilateral enucleations. We don't know a lot more about him. We just pulled blood. We're gonna run a CBC chemistry and see, because we wanna make sure he's systemically stable before we do that surgery, but he seems to be very well adjusted to being blind, and he's an absolute sweetheart. But his face is a little swollen. He's got some really bad mucopurulent nasal discharge, and I haven't really taken a good listen to him, but I'm already in love with him, so. We're gonna take him down to our vet hospital so he doesn't have to compete for resources, and also so we can keep a really close eye on him. B39795. That feels like an old fracture. Yeah.
Good girl.
This is a off-the-track thoroughbred. She has a tattoo, so she was raced at some point. She seems okay. The vets are pulling blood and stuff. There's a lot of horses that come to us with organ failure. So hopefully she's okay. We got all the horses settled down. There's 5 of them. We have 7 more coming in on another trailer. Could be the same one, we're not exactly sure. But we'll just wait for them to get here. And these horses are coming in a day earlier than normal. And because of that, as long as they're comfortable, they're gonna have their intake done tomorrow. We just have a lot of horses that are scheduled. So these buyouts are kind of like a roller coaster or a wave. You just go along, and if they come early, that's keeping them out of the next auction. So there is an auction tomorrow, and that's where we're trying to intercept the most amount of horses. this is how things are planned. We drive around and we figure out where it makes the most sense for things to go. So if anything is out of whack, that's because this is how it was planned. Thanks to an amazing, generous donor, we are doing a major quarantine expansion project, and we're gonna have a heated, climate-controlled intake barn, which will be so amazing. So that's the barn that's up there, and we will be revamping it. But that barn currently is the horses' shelters. So I did tell this donor, like, if we're going to, repurpose the barn, we have to build shelters. So today we are figuring out where those shelters are gonna go. They're 20 by 30 foot shelters because we get a lot of horses in during our big rescue missions. And so Corey is marking off where the shelters would go. And then we're gonna have a tractor team come in and figure out basically the footing and foundation for these shelters coming. And so there's so many building projects going on this year. It's amazing, and we just are so grateful to our donors and like Bob Barker. We had no idea we were in his estate, and so that estate is being split between a spay-neuter clinic and then also an education center. So the education center is coming along quite nicely. We have a few holdups for the new spay-neuter clinic that's being built, but it's all on schedule. So Corey is just marking out where the shelters are gonna go.
So my foot is about a foot long. It's a size 13. So if I just walk along and take off about 1.5 inches with each step, it usually adds up pretty close. So we're just eyeballing it with educated guesses on how big my feet are.
So are you like an air traffic controller?
Yeah, I am.
Okay.
But I'm not really trained on how to do it. So just doing this, and there's flies in the air, just get out of here that way, It works.
Corey has a lot of hats. I never knew that he was the air traffic controller for flies, but apparently the fly population was just directed to leave the shelter.
Put here and bring the panels up, then we could just make this shelter diagonal, but that would be kind of awkward, don't you think? Yeah, so that would be kind of awkward, right? Like, let's say this is one of the corners right here. If we get the road down to here and we straighten it out about here somewhere, then we could just have this a straight run. So we got all the flags marked out, and hopefully it makes sense for them.
Hey y'all, it's Lynn. I just want to let you know in May, we're going to be having an adoption event called Forever Mom Adoption Event, where all the fees are waived for horses, mules, donkeys. We even have cats and dogs. So why don't y'all come on out that weekend? It's May 12th through the 15th.
Please go to horseplus.org and fill out an application so we can set up an appointment so you can come to the event.
And if you have any questions, please feel free to call us at 1-888-474-7077. We can't wait for these guys to find a forever home with you.
I have been extremely busy over here. Friday I came in, Sunday I was in here, and this happened. All this framing went up. Yeah, this education center and these offices are getting built, and I have a feeling I'm going to catch up, and I'm going to be waiting for subcontractors, which is extremely common, but we do have somebody scheduled to put the sides on the building, and then we have an electrician subcontractor. The goal is to have it functional by the end of May. And we're gonna have to get busy if that's gonna happen. So we'll see what happens, how fast we can get this done, but definitely we're on a roll. The education center is getting done, and I couldn't be happier.
We have a pasture that's all grass and that's a lot more quiet and isolated from general population. Jolene is understandably a concerned new mom, and she doesn't want to be caught today. So we're taking things slow, and Corey's just letting her work through it. We're able to catch her already today to give her Foal and enema and some other things that she needed. So I'm sure we'll be successful eventually. Corey just turned Jolene and her new little filly out, and they're doing great. We're really excited for the surprise.
So we just finished doing some distance blood work, and what we found was her red and white blood cell counts. She has a neutrophilia, which means she has an elevated neutrophil count. And then on her chemistry, she's kind of lit up all over the board. Some of her values are super high and some are super low. So she has a low sodium and a low potassium, which we worry about those with kidney, and some with muscle. Her CK, which is a muscle marker, is really elevated. Like the upper limit's 470 and it's 1402. But she did damage her muscle around her eye, so that's probably from that. And she also has icterus, and we also saw the icterus on her sclera. She does seem to have kidney disease and liver disease, and then her neutrophil count, that's also elevated. So she's got a lot of things going on, but we're worried about maintaining her quality of life and her overall long-term care based on these values and the way she presented today with her physical exam findings. So unfortunately, Dr. Lee and I, when we talked about it, think that the last act of kindness is probably the best call for her.
So as of now, we're getting 6 animals from Cookeville, on top of having a lot of horses come to the shelter here today. Keith, Angela, and Jordan are going to be going to Cookeville to pick those horses up. They're going to grab some panels to load up to take with them to make it a little bit easier for loading and unloading.
Loaded up, ready to go. I'm waiting on a couple people, and then we're going to head off to Cookeville, see what we can do.
So today's buyout week, and we're gathering all of our stuff to get ready to go up to quarantine to receive the horses and start intake.
I didn't know what my heart was in for till you stepped into the room. And I didn't show, but I wanted to know everything I could about you. See, I was told the dreams were made to be believed in, so I put every single dream in you.
He's a standard bred. He cannot put weight on his leg. He's a standard bred. He does have shoes on. We're just trying to get him comfortable, so.
Yeah, his heart rate's in the upper 80s. I'm gonna give some IV Banamine.
You wanna explain what that does to him?
Yeah, so this is pain and anti-inflammatory medication. His heart rate is very high and he's non-weight bearing lame, so he probably has a fracture and we don't want him to be in pain, so we're giving this right off the bat. And Tani, I've got a stall ready. I don't know if we can safely get him right there, but let's try to get him maybe in that closer one. So this is gonna kick in really quickly and provide him with some pain relief so we can do some diagnostics.
See, I was told the dreams were made to be believed in.
When he holds it up, his leg kind of swings and dangles medially, so we probably have a full fracture. So this poor guy came off the trailer. Tani and I snagged him immediately. He had pain and anti-inflammatory medications administered intravenously at a pretty high dose within 30 seconds. His intake heart rate was 88. So heart rate is one of our best indicators of pain. If you look at this horse's musculature, he's got severe atrophy on the right hind and hypertrophy on the left hind. So he's been compensating, and he's got his left hind leg turned in and tucked underneath. He's been compensating. That degree of atrophy and hypertrophy takes time. So this horse probably injured this leg at least months ago. So what we want to do with him is do some diagnostics so that we can give him the best chance of survival. If he has a femoral fracture or a hip fracture, that's unfortunately not survivable, but an abscess sometimes can manifest as non-weight bearing lameness. So we would never want to euthanize a horse that has a condition that we could treat. So because we have 19 other horses that just showed up, we want to make sure that every horse that arrives gets appropriate triage. We're going to let this guy have a drink, have some hay, let those pain medications kick in, and his response to those pain medications will help our vet team determine what his prognosis is.
Last month we had a very critical horse come off the trailer, non-weight bearing on one leg, and I said he's very critical, he's a priority. And some of our viewers didn't realize, like, we put him in a stall just like we did him, and they're like, if he's in pain, why are you just leaving him there?
Yeah, and he had pain meds
He
right
had
away.
pain meds right away, so...
I'm just sneaky with the pain meds, and I don't always stop and make sure it's on film, because that's... I know.
We're not able to pause and explain everything, but the reason sometimes, like, we put them in here is sometimes it's the first time in their, you know, last year or 2 years that they're actually pain-free from the pain medicine. So bringing a horse in that's extremely critical into the stall with pain meds, water and food is kind of the first time they're able to find peace. So we're not putting critical horses in here and walking away and they're suffering.
Yeah.
They're under vet care with drugs to make them comfortable.
Yeah.
So I put every single dream in you.
Her mane is braided. I think she was probably a horse that somebody cared about. And like, we'll give her away to a good home, and they braided her mane and they tried to make her look nice. And this is what happens when you give away horses that have medical problems. Do not give away a horse that has medical issues. Take it to your vet. You are the most responsible person for that horse, and please be responsible so we don't have to get horses like this.
She's been laying down for long enough that she has skin infections just from being in filth.
We're about to take radiographs on her front feet, first her left front, and then we'll go from there.
But you said the bar so high above the sky.
So this really pretty paint mare, we were suspecting she had founder, and radiographs confirmed that she has severe rotation greater than 45 degrees in the 1 foot that she would let us take radiographs of. So unfortunately, this advanced stage of it, there's nothing we can do to really manage her pain long term. So for quality of life purposes, we think the last act of kindness is the best thing for her.
Before they unloaded the trailer, they did tell us that they had a horse in there with in-place trach. I've never seen one in place before. The smell is absolutely nauseating. It's completely infected, so we're doing blood work to figure out what we can do and if it's safe to operate on this animal so we can remove that and hopefully clear up the infection.
She does have a grade 3 to 4 murmur that we can hear on maximum intensity on the left side. So we're just going to microchip her and deworm her and then put her out with her friend that she's bonded to, and then we're going to further evaluate her when we do her dental evaluation / float to see if the murmur changes at all or how she changes.
I'm fundraising. I'm trying to get out an email. Angela's receiving phone calls and I'm receiving phone calls like, hey, can you take these horses? Hey, I'm gonna take these horses to an auction. Can you take them instead? And we can if we have donations. And it costs approximately $1,000 per horse for us to rescue it and give it its initial care. So we have trucks and trailers coming here today. We also have a truck and trailer over near the auction to intercept horses over there. These rescue missions are a huge effort, and it takes a lot of donations, and fundraising is my job. So I am trying to get as much done fundraising as I can. I'm just getting an email set up to be able to send out, and I'm just trying to express the urgency, and that's the hard thing for me is like the slaughterhouse are here. If they go to the auction, especially because, I mean, they kicked us out, we're not able to bid against the kill buyers. It's vitally important for us to intercept these horses. But if we don't, their future is just going to be USDA number on the export slaughter report. And if you watch these videos, like we get a lot of really big horses through here, and these are horses that if they went to auction, we probably wouldn't be able to rescue them because the kill buyers would be bidding them up so much. So we're just trying to save as many as we can.
Sure, this horse is about 20 years old. He is fully blind in both eyes. His heart rate was about 52, which is a little bit elevated, but they just got off the trailer. He's got a little bit of some back pain. And so far, that's all I have assessed. His heart and lungs sound normal. He's got some bony abnormalities on this splint on the left front. So we're gonna probably need to take some radiographs. But he seems to be stable. So we are gonna vaccinate him and get him microchipped and dewormed and have all of his orals. Hi, buddy, I'm gonna touch you over here, okay? Good boy. So this is, normally we give a 5-way vaccine. We had donated vaccines, so our West Nile is actually separated from the other components. So this is 2 injections on the left. Normally we just have 1, but we're super grateful for the support. I think it's called the Unwanted Horse Campaign. So they donate supplies. They donated 20 5-way vaccines and 20 rabies vaccines, and those vaccinations are really expensive. So we're super grateful for their support. Horses are hindgut fermenters, and the equine microbiome is very important to overall health. Anytime we have stress or changes in diet, we can upset that microbiome. So we try to give these guys probiotics when they come in. These are probiotic treats that he doesn't love. He's kind of begrudgingly eating them. Well, that incisor is just completely missing. I know. So Galvani's groove is completely absent, so she's at least 30. And she has a very severe heart murmur. You're a good girl. You're a good girl. Oh, she just doesn't have, she doesn't have teeth. Okay, let me see this side. Good girl, I know, mama. So horses are brachydonts, which means their teeth are continuously growing, but at some point the rate of growth and the rate of wear become out of sync. So this mare has, her teeth are worn past the level of the gums on her upper right, and then on her upper left she has some really sharp points, but essentially no occlusal surfaces. So she's been trying to chew a cookie that I gave her like minutes and minutes ago, and you can see her body condition score is extremely poor. And then she also has what I graded as a 6 out of 6 heart murmur. You can almost feel it from the outside. So she's got some advanced heart pathology. This sweet mare, unfortunately, is in the shape that we see a lot of draft horses in. She's at least 30. I think she's probably over 30. She's in pretty emaciated body condition. Her teeth are worn way past the point that we can do anything with them. And then she has a grade 6 out of 6 heart murmur. So her heart murmur is as severe as it gets. I can almost feel it from the outside of her body. Her heart sounds are also muffled. So when we have heart disease, because blood goes heart to lungs, we often have a pulmonary component to that disease. So I would say that she likely has advanced cardiac disease, and she is at risk of having a cardiac event. But she also is likely not going to be able to gain weight because she doesn't have the ability. I'm recommending the last act of kindness for this mare. It's always so hard with these guys because she probably worked 30 years of her life, and she probably never got any retirement. They just dumped her into the slaughter pipeline.
We are asked to help hundreds of animals every single year. We cannot do that without your support. Being on the front lines of animal rescue, we see things that break our hearts. It's through donations that we're able to say yes to not only horses, but dogs and cats as well. Every animal deserves a second chance. At Plus Humane Society, the plus in our name is for every other animal besides horses that needs help. And we help thousands and thousands of animals, but we can only do that through support from people just like yourself, donating to help us help the helpless. If we don't have support, we cannot save these animals. Please make a donation right now and be the difference for an animal in need.
Keith, Jordan, and Faye and I are here in Cookeville waiting for some horses to arrive so we can pick them up and take them back to the shelter.
We're gonna try and just back up him up and till we meet gates, and then he's gonna open his gates and horses will go boom, 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 hopefully.
Easy, piece of cake, right? Yeah.
Got the first 6 equines loaded. Went pretty smoothly. Just backed up trailers door to door and boom, they went from one trailer to the next. Real nice and smooth.
Some agent from the, like I said, Department of Ag called about this because
we've got all our legal paperwork and we're done anyways. Yeah.
Like I said,
yeah.
He just called and said something about illegal sale or.
It's not. We got all the legal paperwork, dealership. We got everything.
We just don't allow business in our parking lot, like sales and that kind of stuff. So because it's private property. So.
I guess the Department of Ag just called Sam's Club, said we're out here buying horses illegally, which is not the case because we have a dealer's license and they had their paperwork for Coggins and all that. So everything is above grade and above board. But we are now heading back home.
The ag department called Sam's Club and told them that we were performing illegal horse sales in their parking lot and that they had to come out and tell us to leave. So they came out and told us to leave.
We have a dealer license. They have Coggins. There's nothing illegal about that. Well, I guess we will just be putting in a Freedom of Information Act to see what all they said on their phones and whatnot. All right. Thank you. Bye. Well, the Department of Ag guy apparently is still trying to keep us out of Cookeville. He told the theater parking lot, that's where we did our first buyout, that we couldn't do what we were doing and we were doing illegal activity, and then he called Sam's Club and didn't want us there either. So it's crazy. It's absolutely crazy. But we do have a trailer heading back with 8 precious lives that would have gone to the auction tonight. So intercepted at least 8 over in Cookeville.
So we're gonna take radiographs of his right hind leg. You can see how much better he's standing after getting that Banamine. I'm gonna give him some Dormocidin because I'm afraid that leg is painful and we don't want anybody to get kicked getting these radiographs. So I'm gonna give him a little bit of a sedative. We just finished taking radiographs on this sweet boy. We did have to sedate him a little bit, and I suspect he may have a more severe fracture higher up in his leg, but what we found was that he's got some swelling and some abnormalities associated with the stifle joint, and the two major bones aligned in this joint are separated from one another and not lined up correctly. So we know that that's abnormal. That indicates a soft tissue injury. We also see evidence of an avulsion fracture, kind of right here. The tendons and ligaments can get ripped so severely that they pull a piece of bone off. This one is pretty severe. It looks like it's about 1 centimeter in. Based on just that would be catastrophic enough of a fracture, but the way this horse dangles his leg and has it flop medially makes me concerned that we have a full soft tissue tear. So we're not just dealing with a fracture, we're dealing with a catastrophic soft tissue injury of this leg. And even with Banamine and sedation on board, he still is just barely toe touching. So he's not bearing any weight on this leg, even with good drugs on board. So unfortunately for this guy, I think based on the bony remodeling and the degree of atrophy of this limb and hypertrophy of this limb, looks like it was going on for at least 6 weeks, maybe longer, which is just really heartbreaking for this guy. His heart rate was in the upper 80s when he came in, so he was very, very painful. Thankfully, he did respond well to those pain medications, but he's been painful for at least a month and a half, if not longer. So really unacceptable. This horse has masses up underneath and kind of around his external genitalia, and we had some drops of blood on the ground, and he's got dried blood kind of all around his sheath. His penis is not fully extended, so we haven't been able to see that, but it does look like there's a chance that he has tumors that are kind of affecting that whole area. So we just gave him some intravenous pain medication, and we're gonna take some radiographs of his feet. He does have evidence of founder, so we're gonna check and see if we have rotation, and I haven't really checked for digital pulses yet. He's not acting like his feet are the source of the problem right now. It looks like he also had some bleeding from this nostril. Hi, look at your beautiful face. Those eyes are incredible. This is his hoof wall. So that hoof wall is very abnormal, but I don't ever assess for rotation based on the abnormal hoof wall. I try to look at the foot and go, this is about where that foot should be. And then if we want those two lines to be parallel, and you can see this line is actually rotated down that way. But the biggest area of concern, so we have osteophyte formation kind of making a little slipper on the end of this coffin bone. This whole point shouldn't be there, but we have a gas tract running on the sole of this very, very thin foot, almost to the level of the coffin bone. The other foot, this foot actually looks a lot better. So from the outside, looks pretty severe, but if you trim that foot, we still have this degree of rotation, but it's not as severe, but we do have formation of an osteophyte right there. He does have some minor arthritis back here, but unfortunately, that poor guy had so many other multiple problems going on and was of an age when those comorbidities just stacked up against him. If this foot was the only problem, we definitely would have tried because he wasn't actively foundering, but at his age, and especially with cancer as a high possibility too, it wasn't fair to him to try to do that. Horses are obligate nasal breathers, that they put a tracheostomy in him so he could breathe through here. It's definitely infected based on smell and discharge. What's in this horse's favor is that he is breathing through both of his nostrils. So whatever the indication for needing a tracheostomy, he appears to be compensating well. What I'm hopeful of is that if we can get this open, get it clean, and get the infection under control, we can surgically close the trach site. And as long as he's not in respiratory distress, he may be just fine. Like sometimes we put these in from like a snake bite to the head or some other transient reason. But if he has fungal pneumonia or, one of many other conditions that might make a horse not be able to breathe adequately through their nose, and we close the trach site, he could decompensate and go into respiratory distress. So he's stable right now, but we are definitely not out of the woods with this guy. He's got a lot of treatment that he needs. We already pulled blood on him, and we're gonna run blood work, so we'll have a better idea how bad that infection is. So the trachea is supposed to be a very clean area because the mucociliary apparatus higher up keeps all the stuff out. But when we have a giant open hole in our neck, we can get contamination really easily. So absolutely, without running blood work, we're confident that this mare is infected. So she needs that trach taken out and cleaned up and hopefully closed. I think we can get that out.
Do you have any recommendations to horse owners about getting it taken care of before they take their horse away from the vet?
Yeah, I think what's hard about these cases is that I have every indication to believe that a veterinarian placed the tracheostomy. I think what often happens is that people try, like this horse would have had to have been in respiratory distress. And so you do that initial triage life-saving thing of placing the trach, but people don't recognize how hard the aftercare is. So most tracheostomy horses stay in the hospital until whatever caused them to need a trach is resolved. And then if people just run out of funds, then they just kind of give up. These get infected very, very easily. It is not a part of the body that should ever be open to the outside. And you can see the really thick green purulent discharge coming out of that trach. And obviously her lungs are connected to that. So it's really easy to get aspiration pneumonia and fungal infections and a lot of other things in that part of the body that should be protected from the outside.
Horse owners, if they have this procedure done, should plan ahead to at least have the veterinarians close it before they leave the vet office.
Well, not necessarily. There are horses that live permanently with a trach in place, and just like humans with a trach, it is an ongoing medical care. So I wouldn't necessarily say it has to be taken out. What I would say would be if your horse needs an emergency tracheostomy, ask your veterinarian's office for a estimate of what the aftercare looks like and what the cost of that aftercare is going to be, because it's always incredibly discouraging as a clinician to have a horse that you're like, we saved this horse's life, and then people are like, oh wait, there's $4,000 worth of aftercare and this is going to take me 6 months. I didn't sign up for that. And that's communication that can happen on the front end. So knowing what you're getting into can be a huge difference. And it depends on why she needed the tracheostomy to begin with, which we still don't know. Know what you're committing to on the front end. And if you're ever in a position where you have a horse and you know it has medical needs and you can't provide for those needs, look where you are. A lot of veterinary teaching hospitals will take cases if the owner will surrender them for ongoing care. So I hate that whoever had this animal felt like the only option for her was to dump her in the slaughter pipeline. And she's giant, and she's one of the only horses that came in today that's at a great body condition score. So unfortunately, she's the kind of horse that those kill buyers are looking for. We don't know his name yet, but this handsome gentleman is very big. He was too big to fit in our chute. He has a very large, very old wound on his right front leg. And he is young, maybe 8, between 6 and 8. Yes, you're a very good boy. He is a gelding. I know. Does this hurt? Yeah. Yeah, he's more than 6 feet at the withers. Kimberly and Dr. Gina took radiographs of this boy's right front leg. He had a puncture wound, and he's got some concerning bony changes that we hope is not bone infection in that leg. But we would really, really like to try with him to save him. Surgical resection of this area is going to be really complicated. This wound is old, weeks and weeks old. And if we have bone infection, we may not be able to save him, but we're not going to give up. We're going to run some blood work on him, and hopefully we can get him scheduled for this surgery later this week or early next week. If he's not a good anesthetic candidate, the aftercare is going to be really challenging because he's essentially not going to have any skin on his whole lateral side of that leg from the knee down, but I'd love to give him a chance.
Do you always feel tired? Are you having a hard time getting work done? Well, worry no longer. Introducing Celia, Cellular Regeneration Daily Dose. Just take a few and see what happens.
I feel so much better done. Now I can get this application done.
Celia, designed to help improve your health, and with daily use, may increase your energy levels, making you feel vibrant and ready to take on the day.
I've been taking Celia for a few weeks now. I'm able to get through the day and get through the grant applications that I need to process throughout the day without feeling sluggish and down. And I recommend Celia for everyone. It's an amazing product.
This mare is older, but she has, like, I was able to express milk, so she could just be an old brood mare, but we're gonna preg check her and see if we have any indicators of pregnancy. Gotta say, the equine rectum is not nearly as roomy as the pachyderm rectum. You can unclench my arm, please. She's just really clamped down, so we'll give it a minute. I know, it's very rude. Oh. Yeah.
Aww.
Pretty sure I feel rib cage. Feels like it's in the right side. It's like right at my fingertips. So my theory with Jolene in hindsight was she's probably foaled a bunch before and that baby was probably too far ventral. So I'm not 100% positive, but I do palpate positive indicators of pregnancy in this mare. She has a lot of uterine tone and she has fluid in the body of her uterus. So I wasn't able to see baby heartbeat, but I can palpate what feels like a rib cage. So there's nothing else in the caudal abdomen of a horse that feels like a rib cage. This mare is old to be a mom, but she has mammary development and I was able to express milk. And I don't see any activity on either of her ovaries. So we are going to take a close look at her. She needs her teeth done really, really badly. And I'll probably follow up with some blood work on her to see if we can confirm end stage gestation. I think it's right there. Okay, I think I can try to put him back through this hole. I know your mommy is worried about you.
Dr. Lydia tried to put him in once and then he fell again.
Oh, I'm sorry. Can I have like a... Can you just give me something to block that hole and this hole? Like maybe 2 things of elasticon or vet wrap? I think that's gonna work. The same baby bird came out again and fell this time. I caught her almost all the way to the ground and then she dropped like a foot, so I think she's fine. He or she, I don't know the gender of the baby bird, but they're getting out these 2 holes and flopping around, so we blocked the holes, but I think mommy bird can still get out over the top of the vet wrap.
All right, so this sweet older gentleman, he has pedal osteitis changes on his radiographs on his right front. His left front was pretty benign as far as radiographs go, but he did have bilateral abscesses. So we put the animal intex pad on his right foot, since it's the one that he's lame on, and wrapped it, and we're gonna put him in Q1 and do a dental either tomorrow or Thursday. And just double check and make sure everything is okay. He does have a like grade 3 heart murmur, so we're just gonna do some further diagnostics on him and evaluate him, but today he gets to go out to the pasture.
So Keith and Angela just got back from Cookeville. I want to say they got 6 horses, or eight horses maybe, but we're gonna get them offloaded and figure out who's who and what needs what. So I'm just trying to get this guy's age real quick. He is riddled with tumors, it looks like. They're all over his throat and his neck. So I don't really want to put a halter on him because of that. I just feel like it might hurt him more. I'm just trying to get his age. We got to pull blood for Coggins. Oh man.
What?
He's like a yearling. He's got all baby teeth, it looks like to me. maybe not. I don't know. Do you want to check his teeth out for me?
Sure. Those do look like baby teeth. Does he have his... Well, if I'll let you.
Canine? No.
I mean, we could put him in a stall and let Dr. Liddy look at him tomorrow, but if he's got that much going on...
Yeah.
Unless she thinks it's something else other than cancer. I'm coming down here. Don't poop on my hand, but if you do, it's okay. Yeah, there's an empty scrotum, but I don't feel a scar. But I don't feel testicles either. We thought he had cancer, which he might still have, but looking at his teeth and aging him, he's a year-ish old. So he's awfully young to have such advanced cancer. So we're gonna put him in a stall overnight. Dr. Liddy and I are gonna look at him and brainstorm and see if there's anything else we can possibly think of that would not be cancer, that would present like cancer, and then reevaluate and decide his long-term quality of life after sleeping on it and seeing how he looks. So we are just finishing up here for intake day. We got 34 horses. We got through most of them. There's still a few that we have to come back through tomorrow that came in at the very end of the day. But we went through the criticals and got them taken care of. But 34 is not too shabby. So we're done for the day.
So we have a little help today, and they're going to be getting the outside on. I'm going to keep constructing on the inside. I have to run up to Columbia and get some material, but that's okay. Life goes on, and we're gonna get this education center together as just as fast as we can. Because once they're done putting the outside on, we can run the electrical, get the electric hooked up, start running all the wiring, get the rough inspection. It's going to come together really quick. Can we get done in time? Still don't know. We're going to do our best.
And then, let's see, I need 1 sausage mushroom. We had 3 amazing donors who came together, and I don't think any of them knew what the other was doing, but I now have a pizza fund that has been pretty well furnished. So we've been having pizza quite frequently on the Wednesday following the buyout program. Pizza and soda or pop or Coke, depending on where you're from, and potato chips for our lunch today. So I just got done ordering all that, and I just thank you so much, Deb, Deborah, and Linda. You guys are amazing.
Love at First Sight contacted me Monday saying that they had a cancellation for puppies that were going to be surrendered to them. So I asked if we had any. They're going to take 7 of our adorable little puppies and get them adopted out for us. And I'm about to load them up and head out of here. We're off to Nashville. I think we gotta go back a little bit more. I don't think my gate can shut. I guess I can.
Pizza just arrived, and everyone is hungry and ready to eat.
Yes, we're starving. Actually, the starvation is so overwhelming. Just the intense black hole of a stomach that just feels like it's sucking all of my energy out. I can't wait to get some pizza in there so I can get back to work constructing the education center.
Have you ever noticed the older you get, the smaller the plates get, the smaller everything gets? I remember Racy cups used to be this big around. Now they're this big around. That means I'm only old. But
The black hole is filling. Usually I eat much healthier than this, but today this is going to work out. It's simple carbs, keep the energy up.
Thank you, Deb, and Linda.
All right.
The vet team is about to walk around and just put eyes on everybody. We're about to gather some blood on Jolene's little baby to check her IgG. We're gonna recheck our double-blind enucleation potential guy and check out some of the horses that came in on intake and just make sure they're doing okay.
Dolly is a little on the small side. She's not completely abnormal, but she's also not completely normal. She is eating really well and sleeping really well, but she's been having trouble getting up since she was born, as far as we know. So our staff has been helping making sure she gets on her feet. Her gum color looks great. She's well hydrated from the outside anyway. And we're gonna run another CBC and just make sure she doesn't have something else going on. We just got Jolene's baby Dolly's test results back. Her IgG is going the direction we want it to. Her red cell count is normal, her white cell count is normal, and all of the other parameters in her CBC were normal. So we're continuing to watch her closely. There is another organization that's interested in her, but our job is to make sure that she is all the way healthy enough to be transported. It would be a very short distance, but for the time being, we're gonna keep her here and watch her really closely and take things a day at a time.
So because we're a little concerned about Dolly, little Jolene's baby, we're gonna give her some fluids via rectum, and we're gonna give her a teeny tiny dose of some pain meds just to kind of make her more comfortable with it. So I'm trying to warm the fluids that we're going to use, because you never want to give super cold or super hot fluids. You want it to be just right. But so we're preparing to go take care of Miss Dolly.
We just finished giving baby Dolly some electrolyte enhanced rectal fluids, some vitamin B12, and just a little teeny tiny bit of Banamine. She hasn't overtly been off, and her CBC was mostly normal, but she is teeny tiny and we want to watch her really closely. So proactive hydration is always a great idea. She is up and nursing and annoyed, so those are all good things. It's okay. Oh, it's gotta be so uncomfortable, honey. I know. You're all right. Actinomyces or like something mechanical, but the one on the chest doesn't fit with that. Yeah. It looks like he's got one kind of in the brachial plexus area. Do you want to try one of these treats? Look. It touched your foot so you can find it. We are doing our post-intake rechecks today. This adorable little donkey came in yesterday after I had to leave for the day. Dr. Gina did an awesome job intaking him and sent me pictures. He has, 1, 2, 3, 4, 5, 6, 7, at least 7 large bleeding masses. So anytime we have a tumor of some sort, we have to guess whether we think it's benign or malignant. Tumors that look really angry and oozy and bleeding are more often malignant than they are benign. However, he's young and we would love to give him a chance. So our plan is to put him under general anesthesia, see if we can remove the masses. And if we're able to remove them, send them off for histopathology. If he has something like sarcoma or carcinoma or one of the more aggressive malignant cancers, his prognosis is not good. We're not gonna do chemotherapy and radiation on him, but if they're benign and we can get them removed, then he has a great chance, and he's just the cutest little piebald guy. So we're gonna give him a chance. He seems to be quite wary of people. So you're gonna have to warm up to us because we're gonna have to do things with you, sir. But yep, that is our plan. We are adding him to our surgical roster, hopefully for early next week.
The little help I had today actually turned out to be a big help. We got this entire wall on the outside done, and I'm pretty impressed by that. And then I'm just getting the interior walls finished out. Doorway, gonna be a doorway here, and it's coming along good. I'm happy.
So Todd is coming this morning to do riding evals on some of the horses that we got out of quarantine last week. Plus there's a couple more owner surrenders that we're gonna have him check out. He should be here any minute, and we have about 8 for him to look at. So we got Fernando in for his evaluation next.
Hey, this is Fernando. He's a 19-year-old gelding. Probably worked good on the trails. He understands being saddled, picking up his feet, everything like that. There's no issues. Not such a great rider in the round pen, but once you get him out, he went by the construction they're doing, crossed the ditch, over the gravel. Everything should be good.
This is Sonnet. She's in here for riding eval. She still needs to put a little bit of weight on, so we're going to keep it pretty short with her, but we just want to kind of see what she knows. She has been putting weight back on since she had her teeth floated about a month and a half ago, something like that. So we're just going to keep feeding her, and we're just checking what she knows.
So this is Sonic. She is in her teens, probably mid to late teens. Really gentle. I'm going to say she's quarter horse. Super gentle, easy to ride, will neck rein with a little bit of help. Rode her in a junior cow bit with a dog bone in it. I rode her with a S Hackamore. Probably be able to ride her bridleless. She just needs a little bit of weight, but she's a really sweet, good horse. This is Saoirse. She's 12 to 14 years old. Just a sweet little short horse, very calm, laid back. Get your kid on them, let them follow mom and dad around the pasture, whatever. She's just a really sweet, very loving horse. So come up today to evaluate 8 horses. This is 7 of 8, or 8 of 8, I should say. All the horses did really good. All in all, they all got a really good rating. They all are rideable to an extent. Some are going to need more work. Some are just really laid back and trying to take it easy, but it's been a good day. So wrap up, get unsaddled, put them all back up, and call it an ending.
Tawny Preisner here with Horse Plus Humane Society. First off, I just want to thank you so much for taking the time out of your busy day to come and learn about horse slaughter and the PAST Act and these laws that could end the suffering that we see for horses. And I have Jonathan here when I'm in Washington, D.C. Jonathan is there with us, and Jonathan is an awesome guy.
Hello, everyone. It is great to meet you guys. So I've been, my name is Jonathan Taylor. I go by JT, so JT is fine if you guys want to call me JT. But I am Horse Plus's lobbyist. This call that, I asked Tawny to get up and running, this is kind of me tagging you guys in for a little bit of help, right? So my idea and my goal is to obviously be your guys' main voice in Washington, D.C. What we're really trying to do is get these bills attached to the Farm Bill, which is like, it's an omnibus. And what that bus pretty much is all these bills, get a seat on the bus, right? And then the bus drives through the gates of the White House and it gets signed off and checked by the president. And the Farm Bill itself, it's coming into crunch time. So the Senate and the House of Representatives are all in what's called markup time right now for the Farm Bill. So pretty much what markup time is they're all sitting down and they're going through all the list of bills and saying, well, this bill, I'm not too sure. I don't think we should put it in. Or, this bill, the SAFE Act, right? I've heard a lobbyist talk about it. I've gotten multiple emails about this. I think we ought to attach the SAFE Act onto the Farm Bill. And that's what we're going to do and what we're working on doing with you guys with an email campaign.
If you would like to watch the full public meeting, please go to our YouTube channel, Horse Plus Humane Society, and there find more information.
If you enjoy watching veterinary medical and surgical procedures, such as castrations, eye enucleations, and abscess lancing, go to our YouTube channel, Horse Plus Vets. We have no censorship on that channel, so if you want to see all the details of us providing medical care to shelter animals, just go to YouTube and search Horse Plus Vets.
The Department of Agriculture from Tennessee State visited our shelter, and they sent two law enforcement officers and then a representative of the Tennessee Department of Agriculture. And before I get into their behavior, two of them were nice. They were professional. They had their wits about them, and they didn't seem to come with an agenda. One of them, though, it was something else. I'm going to show you, but first of all, I want to catch you up on why they were here.
While we had just started to get in a rhythm of intake tonight, they come and got me. There was a horse that had went through the ring, and when he went through the ring, he was a stud horse, and they said during the sale that one side was bigger than the other, meaning one testicle was larger than the other one. So we actually bid on the horse, and we got outbid on, which happens. It is legal in Tennessee to castrate your own animals. And the individual had went to castrate him, and unfortunately it was a hernia. The intestines had came down. At that point he was contaminated, so at least we were able to help it at the end tonight. So
last year we were at the auction over in Cookeville, and this young man came up to us after the sale, and he's like, the horse I bought, I tried to geld it and something went wrong. And I'm like, oh dear. I'm like, well, I'll get our vet. And at that time it was Dr. Nancy. And what had happened is, in Tennessee, it is perfectly legal. It is literally codified into the law that a person or their employee can castrate their animal. It doesn't specify what type of animal. It literally says their animal. So this leaves it up for interpretation to whatever animal you want to castrate legally in the state of Tennessee. If you own the animal or you're an employee of the person who owns the animal, you can literally castrate that animal. You could tie your dog down and castrate it. And that law is causes so much suffering. It's like, I don't even know how the people who are responsible that could change that law can even rest knowing that people literally can just strap their dog down and castrate it, or their horse. No pain medication, or very little pain medication. And this horse had a testicular hernia and his intestines came out. This was a death sentence for this horse. Even in a sterile surgical suite, it's very difficult if the intestines of an animal like a horse come out, to be able to put them back in, treat the infection, and save that animal's life. And our vet told him, she's like, this horse is going to die. So I offered to buy the horse because we didn't have a premise permit and we couldn't treat that animal unless we owned the animal. So I purchased the horse, and literally we euthanized the horse. And it is the most merciful thing to do for a lot of animals. We looked into the law and we're like, wait a minute, what he did was legal. Doesn't make it moral, doesn't make it ethical, doesn't make it humane, but it makes it legal. And so it's like, we've got to change the law. We need to use our voice and our platform to try to change the law in the state of Tennessee to where only veterinarians can castrate horses and dogs and cats. It's like, that's a no-brainer. It's a medical procedure they go to medical school to learn how to do, and yet it's legal for non-veterinarians to perform open surgeries on animals. I'm just like, this is so unbelievable. So fast forward, we do a online petition, and as soon as we do that, the auction sends us a letter, and they're like, Horse Plus is banned from the auction. Like, oh dear. I'm like, well, we'll protest. This has worked before. Auctions have banned us before. We protest. They developed amnesia, like, no, we never banned you. You can come on in. Of course you can rescue horses. This time, unfortunately, the auction has their local law enforcement friends and family sticking up for them, including a officer with the Tennessee Department of Agriculture. As soon as we start walking up the side of a public road, a vehicle pulls over, big pickup truck, flashing lights, Spoke to the property owner on this. 20-foot easement, sir. 20-foot easement. In Tennessee, a lot of law enforcement actually use their personal vehicles for law enforcement, and so you'll see just normal civilian vehicles with red and blue lights, and he pulls up, he's like, you cannot be here. Like, it's a public road. We have the right to be here. Because there was no parking in front of the auction. Like, we're not going to park on the auction land to protest the auction. So we'd park down the road a bit. It was just amazing how fast a sheriff was able to be there, telling us we couldn't be there. We're like, actually, we have the First Amendment right to peacefully gather and protest injustices on a public road, on the side of a public road. And eventually it went up the chain of command with the local sheriff department far enough. They're like, okay, yes, they actually do have the right to be there. And they told us, okay, as long as you're not impeding traffic, you can be here. It's like, and they sure don't really tell that to other protesters around the nation. But okay, we'll abide by that, right? We hold the protest, and we didn't offer to buy horses there because we didn't have horse trailers there, but we did have signs that say we will pay you $500 for your horse if you take it over to this other location. Codified in Tennessee state law is a statute that says you cannot purchase or offer to purchase within 1,000 feet of livestock market property animals. So during that whole process, the Department of Ag guy that first stopped that agricultural crimes unit agent, he went to where we were parked. He told them that we were breaking the law. We had to go somewhere else. It was a mess. He was just kind of chasing us around Cookeville. After he was done chasing us around, we got the horses we purchased back to the shelter. Everything seemed fine. And then some representatives and law enforcement from the Tennessee Department of Agriculture came to our shelter and said, hey, we're just here on a friendly visit. We just want to let you know you do need to get a dealer's license if you're going to be buying horses. And we asked them, well, it does say, you can purchase so many times in 90 days. And they didn't really care what it said. They just had their own opinion of what we could and couldn't do. And so we're like, okay, we'll get a dealer's license. And during the process of getting a dealer's license, the USDA told us that in no short terms that there was absolutely no way legally the auction could keep us from a public auction if we weren't doing something egregious like not paying our bill. And so we got our dealer's license and we're like, let's rent the fairgrounds. This is what fairgrounds are for. Fairgrounds are often used for agricultural events and buyout programs, and we've done one-day open-door shelter surrenders across the nation at fairgrounds. This is what a fairgrounds is for. It's for the public good. And we get there, and what do you know? The fairground operator's phone was blown up by so many people calling him so concerned that we were probably getting sick horses there that he told us to leave. So he literally kicked us out of the fairgrounds. We had paid money and gotten liability insurance for the rent. You shouldn't be able to do that. I can only assume, because I did do a Freedom of Information Act request, and on his official phone, the agent that first accosted us about doing a protest did not call the number for the operator of the fairgrounds. But I imagine he has a personal cell phone that he uses for everything he doesn't want to be available on the public record. And so they kicked us out of the fairgrounds. We ended up getting a donkey that time. And meanwhile, we started doing buyouts at our shelter, and we're rescuing more horses than ever. But those horses at Cookeville are still just going right to that auction where they can be taken right out back, chopped apart, guts hang out, and now there's not even a veterinarian there to fix the problem. What is happening to those horses? We don't know. We're kicked out. Fast forward to a last buyout day. We did send some people over to Cookeville because we have a dealer's license. And they told us as long as you get a Coggins with the horse, you can buy horses as long as they come with a Coggins. So we sent some people over to Cookeville to buy horses that had Coggins. Perfectly legal. Somebody from the Department of Agriculture called the manager of where we were at to tell him we were doing illegal activity and to kick us out. I am planning on finding out who called the manager because I need to file an official complaint against that person. We were not doing anything illegal. We have our dealer's license. We had Coggins on those horses. And how dare they tell the business that we were doing illegal activity on their property. We get the horses back here that we had purchased because thankfully we were able to save some over there. And a couple days later, 2 law enforcement officers and a representative of the Tennessee Department of Agriculture show up at our front door demanding to see the Coggins for the horses we bought over in Cookeville. I'm guessing they don't show up at everybody else's door that buys horses in Cookeville demanding to see their Coggins. But, they say they're not just picking on us. Somebody's picking on us because for some reason, anytime we buy a horse in Cookeville, we get harassed on a legal level. Maybe it's not harassment. Maybe they're just doing their job because somebody over there is reporting us. Every time I file for information on that, they don't give us any information on who's filing those reports, so I can only assume that it's coming from within the Department of Agriculture itself. Now you may ask yourself, what do you mean you're asking for information on who's making reports? In the state of Tennessee, if somebody reports you, you file a Freedom of Information Act request with the agency you're reported to, and by law they have to tell you who reported you. The auction would regularly brag to me and tell me who was making reports on horses that were in bad condition at the auction, because the Tennessee Department of Agriculture would give them the name of the person who made the report. And they'll even give you a copy of the report. So, are they not giving us the Freedom of Information Act request on who's making these reports? Or is it just coming from within the Tennessee Department of Agriculture? I don't know. As you can see from this law, it says notice of inspection, persons dealing in livestock within the state shall submit required records for inspection within 24 hours of any request by the commissioner or his representative for such inspection. That seems to say that you can't just show up and demand records on the spot. So these three agents, or these two law enforcement officers and the representative of the Tennessee Department of Agriculture show up at our front door, demanding to see the 6 Coggins for the horses that we bought at Cookeville. We've had an attorney on retainer for a while now, and he knows our organization well. He knows what we do. He supports what we do, and he's told us, look, if the Tennessee Department of Agriculture shows up at your facility, you get me on the phone. I got him on the phone. And he wanted to ask the law enforcement officers some questions before we turned over the paperwork. The second they heard we had an attorney, one of them, his entire demeanor changed.
Hey, look, Tony, you and I know we was on the same phone conversation. Dr. Beatty explained every bit of this to you. You know by law what the law is. You probably know the law as well as we do. You are required to show those Coggins papers. And so if you're not going to do that, then we're going to go proceed from here.
So I do want to tell you that our board decided to get a lawyer.
That's wonderful. You have 15 lawyers.
We have to follow what our lawyers advise.
No, you have to follow the law.
I have not told anybody to do anything.
Yeah, we're trying to communicate.
All you got to do is show us 6 Coggins and we're out of here.
My question was, did you identify the 6 horses that you wanted to get the Coggins for?
You have 6 horses that they purchased at the Sam's Club. It's not rocket science. We're done. We're done.
Anger, frustration, like beating our desk, like, we're done. No, our attorney is simply asking you some questions. He's a licensed attorney at law. We are going to turn over a copy of the Coggins papers. That's not a problem, but our attorney wants to ask you some questions first to determine what the scope of this visit is about. And he wouldn't hear any of it. He stormed out. He took the other 2 with him. And now they're up the road, and we're like, we have no idea what their plan is. After they left, the Tennessee state vet called Tawny, and for 9 years we've had a good working relationship with the Tennessee state vet. We've helped them with some major seizures, and I mean, it's like we've had a good working relationship with them until the auction kicked us out.
But if that's what a dealer dealer license is a license to buy horses, and there's lots and lots of people out there buying horses, why are we so much under the spotlight when tons and tons of traders are out there buying horses without Coggins all the time? And we're following the book, we're getting the Coggins, and we go somewhere and we're instantly harassed.
So she calls up, she's like, look, all we wanted was the 6 Coggins, and Tony's like, we were going to give you the 6 Coggins. Our lawyer just had some questions. And she's like, well, as a livestock dealer, you have to turn those over. It's like, that's not the issue. The issue is our lawyer just had some simple questions for the law enforcement officers to determine the scope of their visit, and they refused to answer the lawyer's questions. So they spent about an hour and 15 minutes going through the pasture, matching up Coggins to horses, and it's like, all right, this one matches, and on and on and on. And then the last horse was actually in surgery having a double eye enucleation, and they insisted on going in the surgery room to see that horse and match it up to the Coggins. So then they left, and not sure they left super happy, but they left. And I'm sure we're going to be dealing with them again, but we're definitely going to be following our attorney's advice. And anytime they're here, he's got to be on the phone, because I'm sure what he heard was quite shocking to him, and I know it was shocking to me to actually have a law enforcement officer lose his cool as soon as he hears we have an attorney on the phone. He was the one making the situation uncomfortable. Let me be very clear. Our lawyer was not confrontational. He was polite. He's a very good attorney. He just wanted to know what the scope of the investigation was. And this law enforcement officer became so unhinged, I was like, I'm wondering if he's literally going to come over the counter and arrest us and put us in cuffs. Like, I don't know what this guy's motive is here. I respect law enforcement, but there's at least 2 people in the Tennessee Department of Agriculture that seem to have an emotional aversion to what we do. It's the one over in Cookeville, and it's the one of the 2 that was out here. Those 2 enforcement officers seem to have something personal against us. Nobody else was reacting the way this officer was when our lawyer started talking to him. The other one was fine. He's like, yeah, this is my name. This is no problem. The Tennessee Department of Agriculture representative, she was more than willing to talk to the attorney. But that one, I don't even know what to think about it. And I'm hoping that he won't be the next one that comes out. If he is, I mean, we'll be polite because that's what we are. But I'm hoping that he can reciprocate. And also just, if he needs to come out and check Coggins, our attorney's going to be on the phone. That's what he's told us we need to do. It's not a problem showing him the Coggins we get, but they also have to be respectful. And I think maybe that's just a big part of it, is having mutual respect. And we're the 3rd largest humane society in the state of Tennessee. I would think that the state vet would be thankful that we're willing to help horses and take Coggins on horses and give them the vet treatment they need. Maybe they're just, sticking up for the slaughter pipeline. I don't know, but hopefully we can get to the bottom of it soon.